And we have now Dr. Carl Chip Lavie, who's going to speak on exercise is medicine.
All right, thank you. And a lot of my material in this talk was just recently in a major JACC paper on promoting health that was spearheaded by Dr. Valentin Fuster, the editor. And a lot of this information is in one of my recent issues. I'm the editor-in-chief of Progress in Cardiovascular Diseases, and in July, August 2017, we had a really excellent issue on physical activity, exercise, and fitness in health. This is a major Lancet paper. Many of you have saw it many years ago on over 400,000 from Taiwan that showed a very strong relationship between physical activity and longevity, particularly in those over the age of 60. And a major Lancet physical activity series several years ago showed how much physical inactivity is contributing to health. Somewhere between 6 and 10% of all non-communicable diseases worldwide could be attributable to physical inactivity. And basically, they estimated that over 5.3 million deaths per year worldwide could be eliminated if physical inactivity was also eliminated. Now, fitness is probably even more important than physical activity. Those who are more fit have much better survival. And it used to be said if you got above 10 METs, you had maximized your survival. Now we know even getting higher still gets more benefit on survival, but still the slope is much lower as you get above 10 METs. And this major meta-analysis in JAMA a decade ago showed how important fitness is. For every 1 MET change, mortality and cardiovascular mortality were affected by 13 and 15% respectively. And the reasons why physical activity, exercise, and fitness are so important are summarized on this slide. It involves sympathetic, parasympathetic ratios, blood pressure, endothelial function, blood viscosity, mitochondria, sleep, inflammation, insulin sensitivity, and many other factors. But one of the factors that doesn't get proper attention is the effect that it has on psychological stress, which is also very important. We've published a lot on cardiac rehab and exercise training in our coronary patients with many of the benefits, including on morbidity and mortality. But cardiac rehab, even in the United States, is tremendously underutilized, and I'm sure many people don't attend cardiac rehab here in India. But the psychological benefits of exercise are tremendous. We heard about yoga earlier, but as Cicero said, it is exercise alone that supports the spirit and keeps the mind in vigor. So keep this in mind for those of you who have not exercised yet today, even though it is a Friday night. We reviewed all the benefits of cardiac rehab and exercise on these psychological risk factors and the effect that stress and depression have on increasing mortality rates in this recent Canadian Journal of Cardiology paper. And when you look at the studies of exercise and cardiac rehab, really what they focus on is that the benefit seems to come from improving fitness. No matter whether you measure fitness by a cardiopulmonary stress test, by a simple treadmill stress test where you get the METs based on speed and incline, or whether you do simpler things like 6-minute walking tests, shuttle tests, etc., that improvements in exercise capacity and fitness explain most of the benefit. Now, we were disappointed in our recent paper of 1,200 patients followed for 7 years from our cardiac rehab program when we showed that 23% of the patients in our program didn't even improve their fitness level. And those who didn't improve their fitness had much higher mortality than those who had the greatest improvements in fitness. And if you got intermediate improvement in your fitness, you had an intermediate survival over a mean of 7 years. So we have to get better improvements in fitness in our population. So then the question is, how much exercise is needed? The Wen paper that I started off with from Taiwan, 400,000 Taiwanese 7 years ago in The Lancet, made many points. But one of their points was that if you did just 10 minutes of exercise per day, you're already getting mortality benefits of about 15%. And if you did moderate exercise, the more and more you did, the lower was your mortality, or the greater your mortality reduction, up to about an hour per day. And then the line starts leveling off. But if you did vigorous exercise, and they define vigorous exercise at just about 7 to 8 minutes, so it's not super vigorous, they showed the line was starting to level off after just 30 minutes of exercise, of vigorous exercise, suggesting that if you did more and more, you were not getting additional benefit. And this plays into a big JACC paper that we had published several years ago of 55,000 people. We looked at 13,000 runners compared to 42,009 runners. And we showed that the runners had 30% reductions in mortality and 45% reductions in cardiovascular mortality. And that was not so surprising. But when we looked at the dosing, we divided the 13,000 runners into quintiles of dosing. The lowest quintile, which only had people running 1 to 2 times per week, less than 10 kilometers per week, running less than 52 minutes per week, they got the same benefit as those who were much higher dose runners. And we actually showed in the Mayo Clinic Proceedings paper about a year and a half ago that the very highest runners actually appeared to lose the benefit. And this raises the possibility that there could be some adverse effects of running. And we know, for example, after marathons, a lot of people release brain natriuretic peptide, troponin, they dilate their heart and get some cardiac dysfunction. So as Socrates said centuries ago, if we could give every individual the right amount of nourishment and exercise, not too little, but also not too much, we may have found the safest way to health. And in our recent JACC promotional paper on physical activity, we summarized all the benefits of physical activity and the obstacles that need to be addressed to improve the delivery of better physical activity to all aspects of our medical care and practices. So in conclusion, the guidelines years ago suggested that we should all be doing 150 minutes per week of moderate or 75 minutes per week of vigorous exercise. The Institute of Medicine recommends 60 minutes a day of some form of physical activity, but recent evidence suggests that the benefits of exercise occur at even levels well below this, even at just 10 minutes per day. And with running, for example, the maximal benefits occur at very low levels. In coronary disease and in some of our heart patients, toxicity may occur at very high levels, but in almost everyone, the maximal health benefits occur probably at 30 to 40 minutes a day and certainly less than 60 minutes a day. And promoting physical activity and exercise is needed throughout the healthcare system, which could start with exercise or fitness actually being a vital sign, along with things like heart rate, blood pressure, and weight. And so this, I think, sums it up. Many people say they don't have time to exercise, so what fits your busy schedule better? Exercising so many minutes per day or being dead 24 hours a day? Thank you.
Thank you very much for this very important topic, exercise. Very few of us do it. I just wanted to ask you one thing. It is said in the middle-aged or elderly we should not do jogging. It can spoil the knees. Is it true? Well, many of my patients ask me.
Yeah. So if you look at long-term runners, they have less arthritis problems than people who are non-runners. Now, there could be some selection bias, and those who are not getting the joint problems are able to continue running. I would agree, though, if you haven't run when you're young, it's probably not worth starting to run in your 60s and 70s. That would be a better time to just walk, maybe do a bicycle, maybe an elliptical machine, or if you got access to pool, swimming is very good too. So probably most people shouldn't start running when they're older.
Oh, yes.
If they've been running when they're younger, though, it's no reason to stop.
I believe in exercise, absolutely. This is a subject close to my heart. You can prevent so much of disease. As I said, 30% of cardiovascular disease can be prevented by this simple thing.
They say triple E for the card.
What's that?
Exercise, eating habits, emotion.
EE.
Triple E.
Triple E.
Not
Yeah. Yeah.
Anything about isometric exercise? You didn't say anything about that, but that's
Yeah,
also
so the guidelines are now recommending at least twice a week of some resistance training. And obviously, we have a paper that just came out in one of the exercise journals that actually show mortality benefit of resistance exercise in addition to aerobic exercise, its effect on cardiorespiratory fitness. So there are benefits of muscular strength as well. And the recommendations are 2 times per week. And then for older people over the ages of 80, probably some balance training would also be very helpful.
Like resistant training, we know increases diastolic blood pressure. We used to tell that.
Yeah,
A
but
patient with heart failure can also do resistant training, or
no, they actually can. They just can't do heavy weightlifting. If they can, so even a heart failure patient, if they can do 15 repetitions without straining, that's enough to build some skeletal muscle without having the detrimental effects that really high intensity resistance training can have.
Thank you very much. Thank you very much, sir. Let's give him a big hand.
Thank you, Dr. Carl Chip-Lavie, which is a very, very interesting talk. And may we request the chairperson to present the mementos and certificate.